slow down. I think the technology's caught up with us. Welcome to the first of our nursing home meetings. I want to thank everybody, first of all, for coming. I know on a Friday morning, especially after everybody's been busy on a house session, asking you for one more thing is a big ask. But I think getting this started is important. I'm going to start us off with we are advisory only, not statutory, so there really isn't a quorum required I can think of. But that said, I'll start off with a roll call. Claudine Burnham is not here
Yet.
Yet coming. Representative DeRoy is here. Representative England is here. I'm here, at least in spirit. Representative Kaczynski is here. Representative LaMontagne is here. Representative LaRoche is here. Allegedly, Representative Potenza in the parking lot is on the way in, and Representative Wall is here. So we have quorum despite that, and of course we have the commissioners as well. I just wanted to start off I wanted to get this committee going, and I wanted it to work similarly to how our budget subcommittees work. Being the delegation chair, I always take it as my responsibility, regardless of what party that you're on, is to have efficiently run meetings that are transparent and with an eye that at January, when we come with the budget, that it will accomplish something. We'll be able to bring something forward to the delegation that gives us the pathway forward to think about how we're going to address our nursing needs. So with that said, our subcommittees themselves, I never chair the committee. I actually just ensure that they run, that everybody on the committee gets what they need, that the organizational part, and I have delegated to chairs of the committee to actually run them. And I think in this case, particularly given the topic, that is a good idea. Representative Wall is a long-serving member or chair of the nursing home committee, has a really good historical knowledge of it. And I think it's an important voice to have as we work our way through what is a complex issue. The second person to add to this as a co-chair would be Representative LaMontagne. She is on Health and Human Services, and I think it's Health, Human Services, and Elderly Affairs, which is exactly in the wheelhouse. So I'm going to have them run the meeting. My role in this is to ensure that when we put together the agenda for our next meetings, that it's done in a timely manner, everybody's getting it far in advance, all information that you need is coming far in advance to put everybody in the best position when we come here, that you're not wasting your time, that we're actually getting something done. And so from that, I guess I will turn the gavel over. I don't know which of you to turn over. I'll turn it over to Jess. She's the vice chair of the delegation anyway, and I'll let you start us off on the meeting.
Okay. Well, the first thing I thought is I'd like a different name for this subcommittee. I think it's really awkward, and to try to think a little. We're not going to just look at the question of whether or not we fund a new nursing home, but maybe we're looking at a special committee to look at the solutions for long-term care in Strafford County. Okay, and maybe we can think a little broadly about that. There may be a multifaceted solution we can come up with at the end of this committee. So, is there any comments about that?
I like it.
Okay.
That's a good start.
Okay. And then you all have on your on the table some information about the history of county government, and also what's in statutes regarding our obligations for a nursing home. And I think we should all review that to know that this is a starting point. Okay. And I think most of us know, the basics, but if you look at paragraph 4, county government is responsible under state law for funding the long-term care and support for those individuals who are Medicaid eligible financially and also medically eligible for nursing home level care, who reside in a county nursing facility or private nursing facility or cared for at home under the Choices for Independence program. In addition, counties must operate county jails. We have to talk about that. But mainly that's the long-term care component. And then in statute, the commissioners of each county shall appoint an administrator for the county nursing home. That's the main part there. On the next page, the county commissioners may adopt rules and regulations for the governing of and administration of county departments. And including in there is the county nursing home, county welfare offices, and any other county department. And is there another page on that? No, okay. Yes. Yes, cool.
All I wanted to add to what Jessica has said is, when you look at these 2 pages for the state law, all these numbers underneath the references. So that backs up what you have for the law, even though it's very, very brief. It states that we have to have a nursing home, every county does. And on this long sheet that Jessica pointed out to you, paragraph 1, 2, 3, 4, the big one, tells you the responsibilities that we have for our nursing home, for our people who really, really need nursing care. So that says every county has to have a nursing home. We are all responsible for our residents at our nursing home. Thank you, Jessica.
Yeah.
Got a question.
Yeah.
So that was my first question that came up when we had our executive meeting last time. I have an implicit bias as a planning person that the minute you give me a piece of land, I will start like working on a site plan on it. I can't help myself. And I think Representative Bailey actually backed me up a little bit where he said, okay, and that's to this paragraph, what is the actual role of the county? What are we responsible for? And then how do we fit into the long-term care or elder care ecosystem of private nonprofits and that? Because I don't have a clear understanding of that. And I thought that is, I think the chair of the commissioners brought that up also financially. And I think that's a fundamental starting point that we need to have, because you can't talk about a site plan if you don't know what your responsibilities are. And so I was wondering if the commissioners may kind of clarify to us, because we just read the statement, but what does that mean in terms of practicality?
Okay. What it means, this, I'm gonna take about 2 minutes to give you some history. Share that with you. So you'll understand where we've been and the reason why the counties are in this business. Basically. Prior to the Civil War, all municipalities in New Hampshire ran city farms or town farms for their poor. Okay? That was their welfare system. They all ran farms. If you've been to Portsmouth and you see Woodbury Avenue, you ever hear Woodbury Avenue in Portsmouth? Okay, Levi Woodbury was the mayor of Portsmouth. He started the first city farm out where Woodbury Avenue is today. That was the woods back then. But all the poor people and the mentally ill and the sick out on this farm. Then when he became governor of New Hampshire, he wrote a huge expose about what he called the vicious poor and how they were a drain on society. The fact, now, this is not, I'm not making this up. You can look this up. It's in New Hampshire history. Up until the Civil War, cities and towns were responsible for their own welfare. Okay? And then after the Civil War, there was a movement in New Hampshire as a result of the Civil War, because back then we had debtor prisons. People went to jail for owing money. Okay, we got rid of the debtor prisons. You owed people money, you couldn't pay your bills, you went to prison. With that shift during the Civil War of our attitude regarding slavery and economic slavery, all right, New Hampshire put the counties in the farm business. It happened after the Civil War. And they did that because it was cheaper for the counties to operate on a regional basis to provide certain forms of what we call today the modern welfare system. It happened after the Civil War. Okay? Go ahead.
Is that in large part because there were so many veterans that had?
The veterans or,
disabilities?
people with arms missing, legs missing,
Yeah.
couldn't be employed. There was just a bunch of reasons, okay? But so they put the counties in the business. So when you look at all county governments, right, shortly after the Civil War, including our county, they built almshouses, houses, which is what we have here still today. Okay, the almshouse house still exists. We use it for other purposes. So, what's that?
I said, let's fill it.
Yeah, so it's an almshouse, okay, so it was, and we housed mostly the mentally ill and those people who had sicknesses or they had diseases that we didn't understand how to treat them. Okay, so we built them all out here in the woods, again, away from the rest of society. And that's why we're out here, and, Dover was the county seat, so this was the woods back 100 years ago, 150 years ago. Okay, so we operated that way. And those people were 100% the responsibility of the county. Okay, the mentally ill, the sick, the people who they didn't understand what kind of diseases they had, whatever the program was. And their names were published every year for the public as to who was getting assistance
That's horrible.
and the reasons for it.
Wow.
Okay, and that went on for almost 100 years.
Wow.
Okay, so shortly after the Civil War. With the institution of during the Johnson administration, when Johnson decided to create the Great Society, he created the Medicare system. When he created the Medicare system, which is the federal health insurance system for the elderly. Okay, because back then when the elderly got sick, you were on your own and your families took care of you. They put you in the basement, 3-bushel basket of apples. All right, you live down there, whatever you gotta do. Okay. When they created Medicare, there was a huge debate in New Hampshire. A huge debate in New Hampshire as to whether the counties should operate hospitals. Okay. All right. So during that time, I should back up a little bit. When we were taking care of the mentally ill, we had county asylums. We had a fire here in Strafford County, and we had but that was in the
When was that?
1890 something, right?
Twice.
Right, we had two. We had two fires here, so we killed them. They killed everybody. Died. They're all buried out here. We got them buried out here. We have pauper graves out here. We still have them. Okay. And back then, the county commissioners were in charge of all untimely deaths. When I was first elected county commissioner, I used to go to funeral homes and make arrangements for transient populations and make sure everybody got buried or cremated. In any event, that law has all changed since then. So they took the counties out of the mental health business back then, and they built a state hospital. Because after the conditions that took place, the counties weren't doing a very good job at it because they wouldn't appropriate any money to take care of these people. So the legislature decided to take it over. So that's how we got the state hospital. I tried to put that piece in there, which of course we haven't done a real decent job of that. I was in the legislature in the 1970s. We wouldn't fund the state hospital. So that's been going on for decades and decades and decades. Okay. So up to the 1960s, Medicare was put in place. Every county had a debate as to whether or not they were going to run a county hospital. Okay. Now, members of my family were here when that debate was going on. It was decided that the counties, because of the Medicare system, because Medicare now is going to pay this federal insurance programming and having this revenue coming in, help pay for all these sick people. That's what it was designed. However, when they formed Medicare, a few years later, they recognized that it really wasn't the sickness that they had, but it was the housing that they needed. Okay? Then they created Medicaid. So Medicaid is the bastard child of Medicare. All right? Create Medicare first, then came Medicaid. When they created the Medicaid system, once the debate was held by the counties and the state decided it, and collectively, the counties would not run hospitals, but they would run nursing homes. They would run the housing component, okay? And keep the private sector operating hospitals. Because if you go around this country, counties run hospitals all around this country. Okay, you go down south, counties run hospitals. That's what they do. And that's because of the Medicare and Medicaid system, right? But in New Hampshire, we changed it. We didn't do that. We only took half the baby. We split the baby. So the skilled portion of hospitalization was going to be held by the hospitals, done by the hospitals, and throughout the course of time, rehab centers. All right. And the counties would handle the housing component. So in the early 1970s, they made it, well, it was actually late 1960s, early 1970s, they decided not to build a hospital, but they would build a housing. Every county in the early 1970s built new nursing homes because that was the New Deal. Okay? We did the same thing. We built, in addition to the Arms House in 1971, built 80 beds there. And then 6 years later, in 1978, when I was on the county delegation, we built Building C. So we have 3 buildings, Building A, the Arms House, Building B, the 71 edition, Building C, 78. All counties went through this. This is not new. We're not out here on an island by ourselves here. Every county went through this. Okay. So with the changes, the major changes that have been made to the Medicare and Medicaid system since then, it was a very simplified system back then. Now it's extremely complicated. Initially, when Medicaid was started, the state that doesn't have any broad-based taxes. Brag all the time. Yeah, no broad-based tax, no sales, no income tax. Take the pledge, all that other happy baloney. Okay? The bottom line here is that somebody had to pay for Medicaid because it was a federal health insurance program where the states had to share in the cost. And because the state had no revenue, no ability to raise revenue beyond cigarette taxes and liquor taxes and business profits tax, small rooms and meals tax, they didn't have the money. So the legislature decided to have the counties pay for long-term care and Medicaid through the property tax. Okay? Now, initially, it was 50 cents being paid by the federal government, and 25 cents would come from the county in which you reside, and 25 cents, okay, from the state general fund. That's how it was set up initially. And it went that way for many years. We split the cost with the state. Then, during the Sununu administration, Sununu the father, I was here, okay? He wanted to change it. The state had a huge deficit after Hugh Gowan left office in 81. There was a $40 million deficit. Sununu called the counties in and said, I want to change this formula, the 25-25 split. I want the counties to take on more cost of Medicaid, share of Medicaid. We argued, we fought back and forth a little bit. The legislature decided, okay, we're going to increase the cost down to the property tax. Okay, to make up the Sununu's Gallon's deficit, which ended up becoming Sununu's deficit. Sununu ended up bragging about how he balanced the budget, but how he balanced the budget was to raise property taxes.
Right on the back.
Correct. And over the course of time, since then, the last 40 years, okay? The counties have taken on more and more and more and more of the share of that cost. Okay, so now we're here today. And now of that, look, for every dollar that's spent on long-term Medicaid, 50 cents still comes from the feds, okay? But about 47 cents comes from the county in which you reside. And about 3% comes from the general fund. Okay. So keep that in mind. So our share, our contribution kept to the property tax kept increasing during this time, in this last 40 years. I know because I've been here, okay? So now you got today. Well, let's back up. About 15 years ago, when John Stevens was Commissioner of Health and Welfare, I've been through 11 commissioners of health and welfare. Okay? When he became Commissioner of Health and Welfare, well, let me back up a little bit. In 1997, Terry Morton became Commissioner of Health and Welfare. The legislature had to balance its budget and it didn't know how to. Okay? Had no idea.
Background.
Aiden, mute.
Mute your.
So Commissioner Morton came to the counties and said, we gotta change this delivery system. We have to change the long-term care system. It's too expensive. I didn't disagree. I represented all the counties. I was president of the county commissioners then, as I am today. Okay? I said, I agree with you. We gotta come up with some ways to try to save money. Legislature gave Morton free hand, absolute control and free hand on what to do with health and human services. He could do whatever he wanted. The legislature stayed out of it so they could balance the budget. Back then, he could cut anything he wanted. He could get rid of anybody he wanted. He didn't have to go to fiscal. He didn't have to do anything. He just could do whatever. He was a dictator, basically, because the legislature could not figure out what they wanted to do or what route path we were on. So in 1997, we made changes to the welfare system. I worked with him to make changes to the welfare system, where we would get rid of a bunch of bureaucrats that we didn't need. And there's a long story behind that. I won't bore you with it, but you have to understand how this system functions, okay? At least have a basic understanding. So in 97, we changed the way the welfare system functions. They took the counties out of what's known as the direct relief business. Direct relief now is the welfare that most people think of. They think of the able-bodied man who's 40 years old, who's drunk on the streets, who can't get his act together. Okay, so we're gonna give him, some food and a place to live. That's what most people think welfare is. Okay, but there's more to welfare than just that. Okay. So in 97, I worked with Morton over a 2-year period, and we changed what levels of government would take what responsibility on. Now, I wanted the counties to stay in the welfare business, the direct relief assistance business, because I thought it was cheaper. However, the people in the rich municipalities, in this particular case, Vesta Roy, who was president of the Senate back then, and she went later on, she became governor for a couple of days. She wanted the rich municipalities to have no welfare costs. None. Zero. Okay? So she made sure that all welfare, what's known as direct relief assistance, was transferred to the cities and towns. That way there, Rye, Newcastle, Tuftonboro, Greenland, Stratham, Wolfboro, I can name them all for you, okay, would have no welfare costs because they did not want to contribute to the county tax to pay for welfare. And this has been a debate that's been going on here for centuries. This isn't just something just happened yesterday, okay? So she was successful. All welfare, direct relief assistance was transferred to the cities and towns. all long-term care costs, including what we call today Choices for Independence. Back then, we called it HICBIC, okay? Home and Community-Based Services for the chronically ill and elderly. All those costs were transferred to the county. County used to pay for juvenile delinquency. We gave that up. That was going to be taken over by the state. Now, I negotiated this deal, so I know, okay? It was all transferred to the state. We take on all responsibility for long-term care. When we did that, we got rid of a lot of bureaucracy. We had a whole welfare department here. We eliminated it. Okay, and then, so the municipalities took it on, which I thought was a huge mistake. I still think it's a huge mistake, that's beside the point. It just took, what it did is it took the rich communities out of the welfare business. That's what it did. Okay, so here we are today, okay, with a system that says you don't have to run a nursing home, but you have to pay for it. Now, my debate, 2-year-long debate with Commissioner Morton. Morton wanted to take the counties, Powell back me up on this. Morton wanted to take the counties out of the nursing home business. Okay? I said, okay. And Foster's and the union leader wrote editorials. I got a whole stack of them upstairs about this. Okay? How are we going to pay for this? Who's going to pay for it? Where's the revenue going to come from? Now, if you come up with $250 million, you can take the counties out of the nursing home business if you want to. You need $250 million to do it. Where are you going to get the money from? Okay. How's the revenue going to get raised? Who's going to pay for it? So that debate went on with Morton and I for 2 years. And I convinced him at the end, okay, that it was in the state's interest to keep the counties in the business simply because 2 reasons. Number one, whenever the state took something over from the counties, it cost 10 times as much to achieve.
That'd be true.
10 times as much. They did it with juvenile delinquency. The result of the Sununu Center ought to like ring a bell with you guys about the goddamn millions and millions of dollars you're behind because of those lawsuits, okay? We didn't have those kind of lawsuits when the counties ran it. They didn't exist, okay? But that's neither here nor there. The state took it over. And every time they take something over, every single time, throughout my history, I've been in public office 50 years here, so I got some idea what's going on. Even if I was the town drunk, I'd have some idea what was going on, okay? Every time they've taken something over, it's cost more money. So during this whole process, the legislature has studied this thing 20 times. Well, let's do this, let's do that. At the end of the day, it all comes down to how you're going to raise $250 million and which tax how you're going to raise it and which tax is going to pay for it. And it's no simpler than that. Now, that's the big picture. Okay. Now, the smaller picture, what happens to individuals in the system is that we only allow you to keep $2,500 worth of personal effects, give you $74 a month out of whatever resources you have, and we are gracious enough to have you pay for your own funeral. Yeah. And that's it. Everything else goes to the state to help pay for Medicaid. Okay. Now, some states, we're known as a 50-50 state with Medicaid. And the reason for that is because we're the 6th wealthiest state in the country. Some states, like Louisiana, have an 80-20 split. The feds pay 80% because their state is so poor in terms of per capita income. But we rank 6th in the nation. Okay? So we are a 50-50 state. So that means our state's got to come up with 50% of the cost of Medicaid, somehow. Long-term care Medicaid, short-term care Medicaid, children who receive Medicaid, all those things. So we always thought we were a partner with the state until, I don't know, probably 18, 20 years ago, when John Stevens decided, when he was Commissioner of Health and Welfare, to jam all the costs down to the county. And he convinced the legislature to do that. And so our cost and share has been going up ever since. These were all actions of the legislature, and nothing to do with the county commissioners. Even though we were at the table, okay, it didn't matter. The money had to come from somewhere to pay for these programs. So, and there's been a bunch of other changes, slight changes to the system since all these things I just explained it took place. But the bottom line here is, okay, is that every county since then has had to upgrade their nursing homes because the federal government that pays half the bill created a pile of regulations, mostly as a result of the abuse that took place in the southern states of how people were housed. Bunch of regulations on what you can do and not do in a nursing home and how you have to treat people. Now that has changed dramatically since I was first here. Dramatic. Real tell you that. We have like 700 pages of regulations we have to. Okay. Yeah, go ahead.
Well, I just think that history is fantastic and I really appreciate it. But I was wondering for the next thing we need to talk about is what is our existing relationship with nursing homes and what kind of.
That's pretty simple.
Yeah, but,
Yeah.
okay. I was wondering if Ray wanted to
Sure,
speak to
I'm
that.
sure, you could.
Or-
Sure.
But, well, could he just finish it out? Cause I think
Okay.
it's really important.
Okay,
Yeah.
sorry.
Yeah.
Only because, and I want you to say this because I think it's we did this, when I was first started and elected, Representative Bailey, went to OLS and asked the information about what it is in state statute. I know we have 3 RSAs in front of us, but there is nothing at
That's
all in
correct.
state statute. Now, you have to speak to that.
Okay, I will.
Please,
I will.
because there isn't anything that
There is
requires us to have.
there's no law that requires you to have a nursing home. But there is a law that requires you to have to pay for them.
Yes.
Yeah.
Now, here's where the rub is. And this is a little complicated, but I'm gonna try to dumb it down and make it as simple as I can get it.
Fucking point.
You have to pay for it. Now, private nursing homes right now are barely surviving. And the reason why they're barely surviving is because Medicaid, the rate that they're paid for a Medicaid patient is not enough. And not enough money. So what they do is they take in private pay patients who can pay to offset the cost of the Medicaid client who cannot pay. And the state created what's known as a budget neutrality factor. Now, this all goes to the very point as to why we run nursing homes. Okay? That budget neutrality factor was created by John Stevens. And what that means is the legislature doesn't appropriate enough money in the budget for Medicaid. So, it used to be around the budget neutrality factor, used to hover around 30%. I think what's it down to 24 now, Ray?
28.
It's 28%. Okay, 28%. So they reimburse you at 28% less than you can get. So the private nursing homes need the private pay client to offset the cost of these people down here that don't pay enough. All right? Now, keep that in mind. Which means those private pay patients have got to pay more money out of their assets to cover those who don't have enough money, or on Medicaid, straight Medicaid. I told you they're only allowed to keep so much, right? All their assets are gone. So with that balance, okay, what happens is in most counties, and we've done a series of reports, so the counties have commissioned a series of reports on these things for at least 3 times since I've been county. What happens is that when those folks run out of money and they become really hard to care for, it puts a strain on the private sector nursing home. So they call the counties and ask us to take it. And that's been going on for a long time.
So we're like the last resort.
Correct.
So
We're the final safety net in the system. Okay, between the nonprofits, the for-profits, whatever, okay? There are some patients, believe it or not, that nursing homes won't take. They won't take them. Okay, so that's the reason why we're in the business. Because now, with Morton. Morton said, well, let's get the counties out of the business. I said, okay, you're gonna have to pass a law that forces all the private nursing homes to take everybody and keep them. And as a result of that, you will have to, you'll spend them down quicker. And how are you gonna pay for it? Who's gonna pay for that? You spend them down quicker, right? And then you're gonna have to have some form of rent control. You're gonna have to have some form of rate control beyond what we have today. That's punitive in nature. Meaning you're gonna have to tell the nursing homes, because they'll have a monopoly. Okay, that they can only spend so much money, period. How are we gonna do that? And Morton had actuarials and he had insurance, he had everybody in there, and every expert and every economist in the world in there, trying to figure it out. The bottom line was the legislature was gonna have to create some form of rent control. They were gonna have to regulate the nursing home industry to such an extent to control the cost, because they would have to, I says, we're gonna have to foster some kind of competition. And then what they did was, well, we don't want to foster competition, because if we do, it's really a race to the top, not a race to the bottom, because all these new nursing homes will be constructed because everybody wants to draw in the new, fancy, I want to go to the fanciest place there is, especially if the government's gonna pay. I want to be in the fanciest place. So he was gonna have to try to create this rent control and rate control. So what he did, instead of doing that, and he was convinced that you probably shouldn't take the counties out of the business, because we're the ultimate safety net. What he did then was start to ratchet down eligibility. Ratchet down eligibility. Force everybody to stay home, force everybody to stay in hospitals, force everybody, you have to be half dead to come to us, to come to the counties.
Do you mean medical or
Medical.
financial?
Medical. No, the financial one was already decided. You couldn't take much more. I mean, I suppose you can take the clothes off their back if you want. But the financial piece was already done. We're talking medically ratchet down eligibility. Did the same thing with the hospitals, okay? When years ago, when you had a baby, you were in hospital for 3 weeks, now you're out in 2 days. You have open heart surgery, you're in hospital for a month, now you're out the next day. All those things took place in the system, systemically. But when you did that, you impoverished people quicker. And the private nursing homes don't want those people, because they can't make any money on them, because the rate isn't high enough to make it worth their while. So then comes the counties as the last payer.
I mean, so even if you did privatize, theoretically, we would still have to provide the financial safety net to the private.
You'd have to pay for their costs.
For sure.
Now, some counties have privatized their operations, experimented with it in the last 40 years. And the private sector take over the operations. It didn't go very well. Matter of fact, it went horribly. They reverted back.
Why?
It didn't work. Couldn't control the cost.
Yeah, they probably had.
They just
higher costs.
They
That's
just
right.
they just jacked the cost up, because
That's right.
there's nothing you can do. There's nothing you can't stop it unless the legislature had rent control,
That's right.
rate control, all those other things. They would jack the cost up. Now, as much as I love capitalism, and I do love capitalism, I think it's the greatest system in the world. Okay, but it has some faults. In this particular instance, it has faults. Because you're gonna have to regulate and control it, and nobody had the stomach to do that. They didn't have the stomach for it. So, we're back here again. You're gonna have to pay for it. You don't have to build it, but you're gonna pay for it. And any county that's tried to do that, privatize it, has not done very well. They had to flip it back. Because there's no.
You're talking about privatizing the original nursing home, not
Right.
giving somebody the money to go to a private, independent nursing home.
Right. And then came along the Choices of Independence program. Now, Choices for Independence program is we pay for as well. We're paying for that. gives folks an opportunity to have a choice. But we don't fund it very well. Gives them a choice to stay home, as long as they can, as long as they're medically eligible. Well, yes, but there's a cap involved in that. Meaning, if the cost of keeping you home is more than the cost of institutionalizing you, we're gonna institutionalize you. You're gonna go to a nursing home. So it says choices for independence, but we don't fund it, we cap the cost.
Although we do know that the best place for people to be at,
It's home.
exactly.
No
And-
question about that.
And I would have to say, wouldn't you say, over the last 10 years, that has gotten better in regards with that? Of course, there's a lot of private entities, but the stay at home in care.
Well,
and
the
all
state of
this-
home, nobody wants to go to a nursing.
Correct.
No, nobody wants to go to a nursing home, but the finances of it is where the rubber hits the road, okay? And once you spend more than, if it costs more to keep you home than it does to institutionalize you, the system institutionalizes you. It's not any more complicated than that.
And how is the choices for independence? How is that funded? Is it also but is it also
Medicaid.
50/50 Medicaid? Is Medicare?
Well, there's some differences to that. But you have to be nursing home eligible. Go ahead.
The biggest thing on choices for independence, that I'm on the state and finance committee, and we just met last Tuesday. And one of the things we discussed is the funding of the choices for independence, because the legislature didn't fund it. I mean, they funded it at flat. So there's no, as much as everybody would like to contribute to keeping people at home, it's not adequately funded to keep many people at home, because there's just not enough payment to the private vendors to do that. So there was an increase in the governor put in extra money in the budget to fund nursing homes, the 504 line. The House budget made a 3% cut to all Medicaid providers. The Senate so far has restored that cut. And the extra money that's been put in there is to fund the back amounts that are owed to a variety of nursing homes, including us, that it takes them so long to put people on Medicaid that there's millions of dollars that are owed
Yes.
collectively to all the nursing homes in the state of New Hampshire. So we talk about, we have, well, one of the members of the committee has even suggested, why are you putting more money into nursing homes? Maybe we should be focusing on choices for independence, as more funding. And,
But you're gonna fund it.
but it has to be funded in order for it to be more effective than what it is. And you're absolutely right. It's more effective than what it was a
Yep.
number of years ago.
Correct.
But if you don't fund it, then it can't be any more effective, because people can't afford to provide, the independent providers can't afford to provide the care to keep people at home.
Is it, okay, I'm gonna ask you a theoretical question to that point, exactly. So in theory, shouldn't the choices be hopefully cheaper than actually going to the nursing home? I mean, is it?
No question.
No
Yeah,
question,
something-
yeah. Got staff and of course their benefits and all of that kind of
Yeah,
stuff.
and most of it depends on, the bottom line is if somebody needs 24 hours.
Yeah. that's
Right.
okay.
I mean, and that's kind of the cutoff.
That's right.
If you need 24-hour care, then it's obviously not.
I mean, you're trying to hope, at least theoretically in my mind, and I probably need to show my ignorance. The hope is that you are forestalling the end result, is that you can use the choices as a cheaper, I mean, you may end up in the nursing, or probably will end up with, as your care goes up, but can you get the most bang for your buck? I guess I hate to say it that way.
There's no question,
Well, yeah, there's no question.
no question about that.
What about in regards with, because there's been a lot of conversation about this, I can't even give you a time frame, because a lot of this has to do with federal government. And if it doesn't change at that level with elderly and human affairs, with basically giving families that tax incentive to be able to take care of our elderly. And that's really the biggest crux there, because if it actually came from the federal government, so for example, you know, you have a friend and they're taking care of their mother in their home, that they can actually do that and be able to have some of the resources to be able to do that. So then the burden is not going down all the way to the local, going into, like in New Hampshire, hitting us with property tax stuff. That's really the piece there, is to give that back to people that have been paying into the system that whole time, right? So I mean, this is a bipartisan thing that has been talked about for a long time. Does anybody know if that's coming along?
Well, in my opinion, the huge problem from the federal level and the whole system is that Medicare does not cover long-term care. And the reason it doesn't is because we pay private insurance companies our entire working adult
Correct.
lives,
That's right.
and not one penny of that huge amount of money goes into the pool that takes care of us when we're old.
That's true.
And if we had that system, we wouldn't need Medicaid.
That's right.
Your long-term care could be covered. You could have dental care.
That's right.
We don't cover any of that for our elderly, and that's a big problem.
It's true.
But for me, I think this question of like choice for independence or nursing home, we're missing this middle part for elderly care. That the private sector has all these assisted living facilities for people that it's a little too hard to be at home. They don't need a nursing home, but they can be taken care of. And there are very few options if you don't have the money. And I would say at least half the population cannot afford private assisted living. And I wonder if we think about what our long-term solutions are at the county level, could we have some more nonprofit assisted living facilities that a partnership perhaps with the county, that because it may be cheaper to keep people at home, but the cost of, if you're doing home care, half your staff's time is just spent in the car. Like I don't think that's very efficient, right? And then people are in their homes when they can no longer keep up a big house by themselves. It's not just healthcare.
Yeah.
So that's one of my visions.
And that's one of the reasons why we give that $80,000 to, we fund $80,000 out of the county budget to what, who used to be homemakers is now Easter Seal. That's why we fund the 80,000 is, part of the problem is when you're on Medicaid, you can't be subsidized. So if you accept Medicaid as a provider and accept that payment from Medicaid, there can be no additional payment given to you from any source. You accept Medicaid, that's it. So what we did, and what we currently do with the $80,000 is we work at the Medicaid level and then pay a subsidy for those people that aren't on Medicaid, but still can't afford the home care that's necessary to keep them at home. And we work on a sliding scale with Easter Seals so that the more resources someone has, the less of the $80,000 is contributed to them. But we can't contribute to anybody who is on Medicaid. That, in fact, for those of you that have been around for a long time, you'll remember when homemade in Strafford County actually was fined and their leadership was removed because they were billing us and Medicaid simultaneously. It's against the federal law. In fact, the New Hampshire Attorney General's office actually has a division for that Medicaid fraud division, and that's what it is. And then Easter Seals took them over. And so what we have our contract with Easter Seals for the $80,000 ensures that we don't subsidize Medicaid. We subsidize those people who are above the Medicaid level, but still can't afford the home care in an effort to keep them at home.
Can I ask you about, I don't interrupt on this, because it's along this line of thinking, because I went to Community Action Partners and this is right along like it's not private, but it's nonprofit. And two of the things that came up were Gaffney House, and the other one is, Covered Bridge Manor. I mean, I only read their little blurbs, so I don't know that much about them. But what is their role in this whole picture?
Covered Bridge Manor is actually, it's located here on the county property.
Yeah,
So it is an elderly housing complex that's funded under the HUD concept. So what that means is you have to be at a certain income level.
yeah,
And then your rent is based on the income that you pay, and the federal government or HUD subsidizes the difference.
is that like with the voucher kind of thing?
It is.
Essentially, yeah.
Yeah, but it's not
It's not a
healthcare though.
What, I mean, I mean,
They
I,
take 30%, they take 30% of your income,
okay,
no matter what it is.
yeah.
So if
And
you
then-
get, if you get $1,000 a month of social security,
Yeah.
they're taking $300 a month, you to live there.
And they
okay?
bridge the difference.
And they bridge the
They
difference.
bridge it.
Yeah, I mean, I throw that, I hate to use that term, but again, that was the concept.
Yeah, they
So
bridge.
both of those, the Gaffney and, does Gaffney work? with
I
them?
honestly don't know, but
I don't
I
know.
honestly can't tell you about Gaffney, but what I can say, as an example, when on a rare occasion, we'll have somebody that comes to Riverside that actually gets better.
Okay,
And when we're able to discharge them, part of the ability for us, or for the fact that Covered Bridge Manor is located on the county property, they move to the top of the list.
okay.
Right.
And right now, the waiting list is, they're not even accepting
They're
applications.
years on.
They're not even accepting applications
Right.
anymore, because I have somebody that,
When, can you tell me when the not even accepting applications anymore?
my understanding is that's just happened within the last number of months,
Yeah.
because
We're
they,
talking months?
yeah, and they're
It's just-
years worth
it's
of
years.
applications
I know.
behind.
Yeah.
And so they're saying, we're not gonna, it's just pointless right now for us to accept applications, because we're so many years behind.
How many do they hold?
I think that's about 26. Now, some of them are two-person, husband and wife, some of them are one person. I don't know the exact split. It's been a lot of years since we negotiated the giving of the land in turn for allowing us to go to the top of the list and discharge somebody there.
So part of the original plan, and assisted living is. Part of, the issue with assisted living is it's unregulated. It's unregulated.
They have to be licensed,
Well, they have to be licensed, but
so there's some
But
regulations.
There's some inspections.
there's inspections, but it's the amount of money you pay, what you
Right.
contribute, all that stuff. It's unregulated. Okay, so you have outfits like in Durham, like Riverworks, you can give them $500,000 and spend $10,000 a month and have a good time.
That, I was gonna
Those
say,
are-
that's pretty much that's what you're looking, you have to have about $500,000.
Well, it
If
depends.
you're using Riverworks, let's use
I'm not
another
thinking
one
of
as an
Riverworks, I think it's a
example.
wonderful facility.
I know, but let's use another one as an example. So
Right.
are you still looking at, even though let's say your house, all of that is lumped in, so all your assets. Are you really looking at about $500,000
No,
and then you're still looking at 10 grand a month?
No, Riverworks is by far the exception to that.
Okay.
Right,
It's a CCRC. So Riverworks is different than the assisted living that you perhaps see on 155.
Yeah, okay.
Riverworks takes care of you all the way through your life. So if you are no longer able to stay and be independent, they will then take care of you at a nursing home level.
So that's exactly like the one in Concord where I looked at for my Nana, but you still, to come in, like she was going in as independent. But you still had to have, I think at the time, now this was about 15 years ago, I think it was about 275,000 that you had to have, literally liquid at that point. And then, but there's still, of course, that, monthly
Yeah.
commitment, which, if you're talking about her social security and everything else,
now,
a drop in the bucket there.
some of them are not like that, though, there's a monthly fee, and then upfront you may pay, what they call it a community fee,
Yes.
and it might be $5,000.
Oh, okay.
$10,000, but some of them, you're
Are
not,
not that big,
and
huge.
you don't have to sell any, all your other assets,
Correct.
until you're out of money.
Until you're out of money. Okay.
Well, then when you're out of money,
When you're out
that's
of money.
when, that's where the rubber hits the road. That's when we get the call.
Right.
Yeah.
Okay,
And don't think, when they tell you, don't think otherwise, because they call us all the time. They have for years. When they're out of money and someone's difficult to take care of, they call us and we take it. And we have, and that's the facts. People say,
Well-
oh, that doesn't true. That doesn't happen. It happens.
And we actually give them some priority on the list because
Right.
it makes space for somebody else to
Makes
go in
space
there
for
when
somebody
they're
else.
full.
Right.
oh,
So we.
oh, I see what you're saying, gotcha.
We try and. Unlike some other counties, I just wanna tell you ours is different, so if you hear something different from another county. When our waiting list comes up, like now. Okay, when we have a waiting list for the number of beds that we have open. The waiting list, it'll come to me to set a priority. Our first priority, of course, is someone at home that's unsafe. That's our first priority. Our second priority is to work to take people from the hospital and or assisted living or another nursing home that can't manage the particular person. And that's no offense to the other nursing home. It's just that what Medicaid reimburses them doesn't allow them to staff, to manage that extra care that particular person needs.
Gotcha.
Now, that could be medical, it could be behavior, it could be a variety of reasons, and that's not their fault. So I don't wanna make it seem like I'm saying something bad about other nursing homes. It's from my direction from the commissioners, my whole facility is all Medicaid. I mean, I have a few people, and you'll notice in the budget that there's a few people that pay privately. Those are just people that are spending down to Medicaid. They might have a month's worth of, money, 2 months worth,
Oh.
3 months
You
worth.
spend it now, you have to spend that.
And then they spend down to that $2,500 level.
Okay,
So I can stand here and tell you that I don't have anybody that will be, private pay for more than a month or two when they come in. In fact, if for some reason, it doesn't happen, but if for some reason I had somebody that was Medicaid for more than a year, I have to go to the commissioners and explain why we should be taking them. Because if those people will be taken by any nursing home. Why does it have to be us? Because that would eliminate a Medicaid bed, that
Right.
somebody that doesn't have the assets to come in.
So we're a partner in this thing.
We're
Because-
partnered with the private
the
nursing
private
home.
because we're trying to help the private stay in business. Okay, because we don't appropriate enough money from Medicaid to cover the cost. So we're a partner, we're actually a partner with them. We're not in competition with them. We're the final ultimate safety net. We take the sickest of the sick away from them. Okay, so they can continue to make a profit. It isn't any more complicated than that. Okay.
It's almost so they can stay alive.
This so they can stay in business, okay? And most counties do that. There's one or two
In,
exceptions.
in the last nursing home proposal, it was specifically stated that you were looking to attract private payers.
For skilled care, on the skilled care end. That's correct.
And that can be a temporary situation,
That's
right?
temporary.
Well, temporary maximum skilled care, which is paid for by Medicare, by the way, is a 100 days at a depreciating amount.
oh, I see.
So the first 20 days, they pay fully, and then after that, there's a contribution. So if you're otherwise on Medicaid, let's take a real life example. Say someone is at Riverside and they're on Medicaid and Medicare. Almost all of them are what are called in the industry duly eligible. They're eligible for Medicare and Medicaid. If you say this is an administrator's second worst nightmare. You fall and you break your hip. Okay, that's awful. You go to the hospital and you then go, as long as you spend 3 midnights in the hospital, say you have surgery, you spend 3 midnights in the hospital, you are then eligible for your Medicare benefit. And those people we can take back, because, you know, we have a full physical therapy department, so we can do the rehab and get the skilled care. There is some things, post surgeries, post, serious wound care as a result of surgeries. We're not equipped to do that.
Complications.
Or IV, IV therapy. I mean, we do IVs obviously at Hyder House, but not, for end of life, but not at Riverside. There's not enough of a demand for me to train my nurses
No.
to do that. There's just not enough demand.
Yeah.
So those people will go to, one of the private nursing homes. And in some cases, they make me sign a guarantee that I'll take them back after their skilled care is over. Because they can't afford to keep them. So mostly, because I've been around for a while, they'll take my word for it. But in a couple of cases, they've actually made me sign a guarantee that I'll take them back when their skilled care time is over.
So I just like this, I don't mean to interrupt, I just like the skill, because I don't really know what skilled care is, I just want to.
It's your Medicare benefit.
So that is like kind of, in essence, though, what you're talking about is really kind of like rehab, right?
That's exactly right.
Okay,
That's
I didn't mean to interrupt, I just.
No, that's exactly
That's
right.
it.
And you're eligible for skilled care up to 100 days, as long as you continue to show progress.
Okay.
If you don't continue to show progress, then your skilled care time is done.
Yeah, and I do wanna, cause I'm very familiar with this in Merrimack County, so, in regards with skilled care and the wonderful nursing homes right now that are doing that, let's just talk about wound care. That is a huge, huge issue across the state.
Yep.
In Merrimack County alone, the nursing homes that do have that wound care are not doing it. There are patients that have sepsis and all of that kind of stuff. I have a lot of friends that are in nursing home care right now because they don't have, even though they are a skilled facility, they're not even doing it up to speed. It's unbelievable, the stories that we have heard. They can't hire staff. So an outside entity, so is that even happening here in Strafford County?
Yeah.
I've never even looked at that. There is an outside wound care place that some of the homes or
We have
people
double
that.
rehab, we have.
We
Yeah.
do it.
Landing place.
We have a nurse that's certified in wound care.
Right.
But I will tell you that she works cooperatively with an outside entity that comes in weekly or every 2 weeks, depending on our caseload, so to speak.
That are looking at those specific patients.
With us, with my nurse, that they go around and look at those specific patients.
Yeah, it's unbelievable.
And I will tell you specifically that is one of the triggers of your survey or your federal inspection.
Big time.
Big time survey. They ensure that you're providing adequate wound care. And if you are not, it's not a minor little write-up.
It's huge.
It's what they call an immediate jeopardy or an IJ, which means fines and that kind of stuff. Fortunately, we've never had that happen in my 40 years there, almost 40 years. We've never had an immediate jeopardy or an IJ, where a lot of places do have. Well, I don't stand there and look around for who has IJs or not. I do know what the other county homes do because we share that information. And I also know the state inspectors do what's called Survey Live, which is they periodically, every 3 or 4 months, the head of that department will do a Zoom call where everybody can dial in to listen to what happens, what are the problems that they're seeing out as they're doing surveys. So survey is anywhere from 9 to 15 months from your last survey, or anytime there's a complaint. Anytime there's a complaint, which could be self-generated. I've never had a complaint from the outside sent to the state. All the complaints we have are self-generated complaints, and we have to report everything. It's a lot more stringent now than it used to be in terms of reporting. The feds have come out with a lot of additional guidelines for self-reporting. And if you don't self-report, and they come, then they they give you a deficiency for self-reporting.
They should be looking at themselves instead of looking at you.
Well,
Yeah.
they give you a deficiency for self-reporting and they give you a deficiency for the actual event. So you get double deficiency if you don't report it.
So I think this has been really great to have all this background. And I'm sorry when I cut you short, because and we had talked about trying to keep the meeting to 90 minutes, so that gives us only 20 minutes left.
Okay.
But, I mean, we could go more, longer if people would like to. But we also want to kind of think about what do we see would be the goals of this special committee? And what are how long we're gonna meet?
Could I just mention one last thing?
Yeah.
And it's important because you outlined as one of the goals today about finances. And I just wanted to give you a brief indication about finances. Anything that we provided you when we hired Lori Shibinette to come in and do the finances, forget them all. They're all worthless.
It's all out the window.
The $15 million is gone. We know that. The hopes that I can't tell you what's gonna happen to Medicaid on the federal level. I can't guarantee you that the reimbursement that we thought we were going to get, either from the state level or the federal level, I can't tell you that any of it exists anymore. So I wanna be forthcoming and letting you know that you all, or we, operated under a presumption of multi-page report that we hired Lori Shibinette to do. I can tell you right now, I wanna be right up front and tell you, I can't tell you that any of that exists anymore.
I wanna say that I don't know if it even existed then, because
Well-
on the state level, we are not getting in the money right now that has been promised from some of these CARES pieces. So, that 15 million, I don't believe we would even been able to give that. Right now, where we are is in an unbelievable budget crisis. So we're talking months and months, over a year of where we are owed, this whole federal money that is, like I'm saying, I think the Fed is bankrupt, so I don't know if that's coming.
Yeah.
So we have to really figure out here what we can do on a county level and not have to count on, I know we're gonna have to count on Medicaid, Medicare, I understand that, but we really have to, I think, be focused on what we can do here, that is outside of that and in a responsible
And
fashion.
that's what I'm trying to tell you.
Yeah,
That-
I mean,
that-
we're planning for the worst. Obviously, having done a lot of budgets in my time. And seeing that there is seismic shifts occurring, we're gonna plan for the worst. I've never done a budget where we haven't talked about the impact to taxpayers. So I think that clearly has changed in that, how we're gonna approach this realistically is gonna be a moving target.
Well, I just wanna make sure that I was upfront about that.
Yeah,
Well, that's important. Who has that report? I'd be interested in just reading it, even though.
We have it.
I can
We
get it, I
have
can
it.
get it for you, yeah, we have it.
I'd like to see it.
Yeah, we have.
Well, I would like to go around and hear from everybody about, what their vision of what we might do with this committee. But I would first say, this is very illuminating for me. My mother's been in assisted living. She had a fall 2 weeks ago, broke her wrist and her hip, and she needs a nursing home. And just listening to this conversation, I'm thinking she's almost out of money. After having long-term care insurance, she's gone through that. And I'm thinking that maybe we could cover 2 months in a private nursing home. She may not last that long, but just hearing this, I don't think any private nursing home is going to take her. So we're probably gonna put an application into Riverside. So it's not just for indigent people, it's everyone could be in this situation.
I'm
Right,
curious.
my mother's pension and social security would cover half of what it costs, like $12,000 a month probably to be in a private nursing home. And my siblings and I, we could maybe cover that for a few months, but we'd be spending our own savings to pay for it.
And
So
there's no advantage to that. I mean, you're not gonna get any better care.
That's, I agree.
But still, when I ask friends who are in the medical community, people around here are like recommendations for nursing home. They're like, well, Riverside, not that the care is bad, but it's an old, tired facility. We changed assisted living for my mom, spending more money just so that she could be in a place that was attractive because she was not so out of it,
Right.
But now, the money's just about gone. But I just wanted to put that out there because I've heard it a lot. Like, I see we need a new nursing home, but why does it have to be so nice? Because it's for the poor people. It's for any one of us could be in this boat,
All right.
depending on how long the disability goes on. So anyway, what?
How
why
many
don't
people
we-
here have had a person in Riverside? I have.
Wow.
So I think there's a lot of us that have used it.
So let's remember
And
that.
I don't know that it's because it's so old, to be honest with you, because it isn't about the oldness of it, because I decorated my family's room. I think it's the people. It's all about the people. It's all about the nursing care. So I think we have to keep that in mind as well. I mean, we all are limited on income. We see what our elderly population is doing right now. We have people that I walked. I can't tell you how many houses I went to that I feel like our communities are dying. Our communities are dying.
Yeah.
We can't pave our roads. The sidewalks are terrible. People's houses are in disrepair. The cities are crumbling down around us. And I know that sounds like really bad, but it's true. It's true. I see it all the time. I'm an older person. I see what our communities used to be and what they are now. And our federal government is partially responsible for this. We all have to be very, very fiscal. We really do. The state, the federal government, and we have to push back. We can't any longer sit back and say, oh, we gotta push back on the government.
Well, maybe we shouldn't have given all these tax breaks to the wealthy.
Exactly,
Right?
exactly.
And giving out school vouchers to the
Wealthy
wealthy.
pay most of the taxes in this country. Don't you know the figures
Well,
on
they do.
that?
We pay a lot, they pay a lot less
150%
than they did 50
pay
years
almost
ago.
nothing. So
Yeah.
let's be clear about that.
Not just the wealthy, but I mean, let's face it, it has to be a better system. than
Well,
what
it's
we
gotta
have
be
right
better
now.
than the government system, because the government isn't particularly successful out of the endeavors they get in.
That is so true.
So can I just make a comment? I don't know if we're going around or we're just.
Yeah.
we're
Let
popcorning,
this
but
go over there.
the,
Start over.
so when this, nursing home was proposed, I don't know, what, 2 years ago now?
Four.
Well, okay, when we got to see the big 5-story waterfall movie theaters, that was too much, okay? Too much. Considering what we are required to do versus the luxury. Okay, we're not providing luxury. And I think that was the big NO for most of us. Well, for us, I guess, I don't, but we really need to find a balance of what is required. And yes, it could look pretty, but there are just certain things that are just not necessary, okay? And that's where that buck stopped. Do I think we need a new nursing home? I've been at Riverside. I used to bring the homeschoolers here. Maybe you remember back in the day, 10 years. We would come here twice a year for our homeschoolers to perform for the elderly. It was wonderful. The best facility, because we went to many different facilities and this was the best facility. So there's some great potential. We have the care, we have the 5 stars, we've got it all. But we can't afford a $300 million facility or whatever we were heading towards. I too am now taking care of my mom in my home. Okay, this is not what I was projecting last year, and it's hard. Okay, I'm not, I don't want her to go into a nursing home. I have a home where I can care for her, but every time I come to a meeting, I have to pay for someone to care for her. Okay? So every time we're doing all of this stuff, it costs her money and my money. She doesn't have any money. I mean, she was a factory worker all her life. She's got barely enough, she doesn't have enough money. My husband has to subsidize. It's expensive to have someone come to take care of her.
Yeah.
Okay? I understand that. idea of the care of the elderly is so different now than it was a year ago, because I'm face to face with it every day.
Nobody cares about it until you have to deal with it.
Well, not that I didn't care, it was
That's the
the
bottom line.
cost, it was the luxury, okay, I do care. My heart is for obviously, they took care of us, we need to take care of them, and there seems to be more of them than us right now, so, but we have to be fiscally responsible because we have to pay for it.
Yeah.
And so I think that's really where our measure's been, it's not like we don't want one and we don't care, it's a matter of how much can we afford that we can agree on for quality care, for a nice facility without all the bells and whistles.
First of all, I'm only, and I don't mean to interrupt, but I mean, I think that's what we all want. I've not worked on, and I've worked on a bunch of capital projects. I've not worked on any one of them where everybody didn't say exactly what you said, and it's true. And I think, I tend not to, when I hear basic or anything, I wanna go to what what our requirements are. As I mentioned before, my brain really works as a planning person, so I tend to work with code. And so that follows through in terms of nursing care. So what are our obligations in terms of are the non-negotiables? We gotta do these things. But in terms of what you're saying, in terms of fiscal responsibility and the burden of care, my mother-in-law during COVID begged us, please don't put me in a nursing home. And we were insanely lucky that my sister-in-law could stay in the house with her. She was in Massachusetts, so we had some of this in-home care came and helped us. It was brutal struggle that took a lot out of everybody in the family doing it. So I understand exactly what you're talking about, and I think it is really foundational to what we as a committee are gonna have to do. So thank you.
Let's start over there and go this way. Yeah, I think that would be better. We're gonna put you on the hot seat.
I mean, I've been hearing about this new nursing home for the last 5 years. Everyone knows it. I know there's an old nursing home. It's got like a bathroom to every 15 people. And showers to every 15, 20 people.
42.
42, see? And it's been kicking around now for we're going on 5 years, this new nursing home. What's going on with that? Why do you think it's so long?
Well,
I know the federal government's gonna be involved in it.
right, let's talk about a little, just a 2-minute history about why we did what we did. The original plan for the new nursing home was on the site adjacent to Hyder, which we thought was the best choice. However, it was gonna take us 2 years to get permits through the Army Corps of Engineers. When we found that out, we were chasing ARPA money. The $16.5 million we were promised by Sununu to help construct the new nursing home. We were chasing, we had only so much time to be able to spend the money, okay? So we found that it was gonna be a 2-year process on that site. That site had 180 units of assisted living on it, along with the nursing home. It was a good plan. There was nothing wrong with that plan. Was it expensive? Yes. But we worked on to pare down some of the costs? Yes. You weren't gonna pare down millions and millions of dollars of the cost, but you could have gotten rid of a few things that you didn't like. However, it was gonna take us 2 years to get Army Corps approved. That 2-year wait was gonna be too long for us to be able to spend the ARPA money. Because we had only so much time to spend that money. The feds required us to spend the money only in this specific length of time. So as a result of that, we had to shift gears and come up with a project that was outside of the Army Corps' jurisdiction, which was the Eric Drive site. So we shifted gears because we were chasing $16.5 million, and that's where the 5-story building came from it was trying to fit it on the land. That's why I went to 5 stories. The cost between the 2 projects was almost the same. We went from a 2.5-story building which I wanted, because I thought it was more New England, a traditional New England design, would fit it well in the neighborhood. It mirrored what some people like with Carroll County, you know, it's only 2.5 stories, okay. That's what I wanted initially. But because we were chasing the ARPA money, we went to the 5-story, more industrial looking building on Eric Drive. Of course, it didn't get the votes, it didn't pass. So that sits there. Now, with no assisted living with it. Now, the assisted living component was gonna be privately run. And it was gonna pay taxes, and it was gonna pay a lease agreement to the county, which helped offset the cost of the bond. We had varying amounts of revenue coming in to help support the cost of the bond, which is something we can go into in another meeting. What Ray is saying is true in terms of what the Medicaid rate would be, the reimbursement rates would be. We have absolutely no idea what any of these things would be. Absolutely none. Trump's talking about shifting the block granting Medicaid back to the states at 100%. He won't do it before the election, I can tell you that. The mid-year election, he won't do that. If he does do it, and the Republicans remain in control, we've been through this before. We went through this 30 years ago. Congress didn't have the stomach for it, they ended up not doing it. But he's talking about doing it in the second half of his term, or the later half of his term. So you have no idea what any of that's gonna, what any of that's gonna look like. So what you need to do, to the point that's made about we have to figure out how we're gonna do this on our own, is we have to think out of the box. And when you think out of the box, you've got to, that has to include tax revenues from private sector sources, okay? It includes involving the private sector on the component that we shouldn't be doing, okay, which is the assisted living component. And we need to talk about doing skilled care, and we need to talk about advancing choices for independence and the use of telehealth and all those things that we had in the original proposal, which are still sitting there, okay, that we should be talking about, whether we want telehealth or not, okay, which I think is great, keeps everybody at home, helps you at 3 o'clock in the morning when mom's having a seizure and you don't know what to do, and you're sitting there trying to take care of them. All those things were in that initial proposal. Okay, it hasn't changed. We can change all of it. We can do none of it. Sit back, kick the can down the road. The bigger issue is that Strafford County is aging. It is aging. Okay, we got 16,000 people over the age of 65 right now. It's projected within 20 years, we're gonna have 60,000 people over the age of 65. If you just take the national average, that's somewhere between 7 and 8% of the population over 65 will spend some time in a nursing home. All you need to do is the math. That's all you need to do. Is the math. Okay? It's math. It's not anything else but that. And that hasn't changed. It hasn't changed since the institution of Medicare and Medicaid in the 1960s. It hasn't changed. So.
But we still need it.
Well, you're gonna need something. You're gonna build something someday.
It's been too long.
There's no question about that. The question is just when and what's it look like?
Oh, get breaking ground, right from there,
Right.
at least get something there.
Right? I mean, that's what it looks like. So we gotta, when you want, whatever the committee wants to do is fine with us. I mean, all this information is relatively available. It's just a matter of judgment. Some people just think it's gonna be too expensive, so they don't want to spend the money. I get that. Nobody wants to spend any more.
Yeah.
Okay, if you want to take out the theaters and you want to take out the paved, we'll get rid of the green paint on the pavement, whatever you want to get rid of is, we can do all that. It doesn't, that stuff is,
We'll get to that.
yeah.
Right.
We just wanna go around and
Yeah.
get people's.
It's
we gotta go.
immaterial.
No,
So, I unfortunately missed the tour of the nursing home when we were here, a couple of months ago, so, Ray, I would like if.
Anytime.
I could Tap you and, because I don't have a general understanding of what's wrong with it currently, so that's one of my personal goals.
The nursing home we got now is a disaster.
So,
Gonna be upgraded by, really upgraded. Wrong with the
15 years or so ago, I was the president of the board of the Homemakers. The Homemakers was formed as a result of duties the county wasn't doing. It was a partnership for a long time. And I think we need to focus more on home care. Because what everyone is saying, keeping people in their homes as long as possible
Yep.
benefits everyone.
That's,
That reduces the burden on the nursing home, people are happier, so, that's definitely one of the goals.
But that's hard to do, okay?
It's,
The economy isn't,
I-
people's gotta work. They gotta make them, they gotta pay their bill, it's not easy.
I feel the groundwork has been laid. We've got a basic understanding of where we all are at this point. And what I'm looking forward to is how we're going to approach the fact that there are needs that need to be met. How are we going to do that? What do we have that is lacking? Or what more do we have to have? Because requirements change. And how are we going to do that? That's where I am. Thank you.
Do you like that?
Well, I'm not a member of the
That's
committee.
what I was trying to wrap it up, but anyone else?
Okay,
Spoken?
learning about this, and I don't like to spend money, but I believe in investing money. So whatever we do that involves money, I think I ought to be looking long-term down the road and make something that's quality, that will last, and maybe look at the demographics and think, maybe have it be able to be expandable to meet, needs in the future. I think we have to look forward to see what is it we need to provide the essential services and provide those essential services. And maybe be creative and try to look at different ways that we can provide those essential services at the minimum cost.
Anyone else?
Oh, I already said my piece.
Oh,
No, I already.
okay, well, I will say that when this was originally came forward a few years ago, we weren't offered choices. It's nice to see at least there's some talk about different possibilities here.
Yeah.
Diversity, open minds. I mean, why not look at remodeling the old one? Or possibly it's gonna be a new nursing home. Or maybe you could contract this out. My
It would
business.
cost you more money to remodel that new.
Hold on.
You couldn't remodel.
Oh, we never saw any figures on that, from a couple different companies.
You know, I've been a contractor. for 15
Yeah,
years.
well, everybody's got their own view on this. I'm looking at it. I'm in
That's true.
business. I do it the
You could,
best and cheapest way.
you could remodel a little
It's
bit.
his turn.
Let him go, please.
Now, in my business, as I gotten older, I decided to contract out a lot of it. And initially it was more expensive, but when I look at it now, it's actually come out better. I'm actually making more money, doing less work. Okay, so these are the things you should look at.
Yeah.
But bottom line, with all this talking here, 50% here, 25%, the county, the state, this is all our money. This money doesn't come, there's no benefactor here taking out of their pocket. It's coming out of all our pockets. So, this should be clear. We are paying for this no matter what. Okay? And the other thing, maybe I'm a dumb guy, but I every Saturday morning I'm driving and I hear these legal shows. They're talking about irrevocable trusts. They also call them Medicaid trusts. So I'm wondering how this stands. If you put your money in irrevocable trust, that allows you to hide your assets, to protect your assets. I don't agree with this because I think you should pay your money when you run out. You rely on the benefactors who are the taxpayers. But the fact is, what are those people considered Medicaid patients? Because their money's shielded, their assets. I don't know if you take their cash, but so they're in the same bunch as you're saying the poor people.
There's still a 5-year look back period.
I understand that, but somebody that's clever, smart, you might say,
Actually.
they do that. And I think that happens quite a bit.
It's not, but there is a difference between revocable and irrevocable.
I have a revocable trust. I'm not looking to
Revocable
scam.
revocable trusts are no longer are subject to Medicaid rule. Irrevocable is a different story.
That's right.
But revocable, it ain't worth the paper it's written on.
Yeah.
They'll take your asset, no matter.
Well, they could take my assets. I'm willing to pay my fair share.
Right.
I'm not trying to, I never try to scam the
Yeah,
system.
yeah. I'm just letting you know that
But
that's
I think
changed.
all that
That's all changed.
sort of points to that, the wealthier you are, the more you can protect your assets. But people who could never really even afford to hire a lawyer to put they're gonna lose everything and leave nothing for their children, and that's wrong.
You don't have to be
But-
that wealthy. I mean, houses in
Exactly.
Dover are probably worth $800,000-900,000.
Exactly, but is it still a fair thing that we ask people that they have to spend everything and leave nothing for their children? That just seems wrong.
Yeah.
After they've spent their whole life with their vision of doing that, but
Let's get
but I
out
think
of-
we should get, unless someone else wants to say
I just wanna-
anything.
Yeah, I wanna give, because I never really said goals,
Okay,
so do you have
great.
anything? Nope, sure. Yeah, I think that this committee, I think the whole idea of it is one, fantastic. I think we can put together a wonderful report. I think we should look at everything. I wanna grab the expertise of people that are outside of this, that have been in the nursing home space. I think we should look at all options on the table. That means what we currently have. You know, I don't believe that it can be renovated, but maybe the current nursing home becomes just skilled care. And that's the renovation piece of it. And so that piece of property right there could be just used for that. I love the idea of the hospice house and that being just this end of life and having specific numbers for that. And also, you can have that really be where private pay people are using that as well. I know how successful hospice care is in Merrimack County, which is unbelievable what they've done, and we could be that too. And because that's a piece of an option too. So as well as not just our county property stuff, you know, maybe other locations that make sense, maybe two smaller types of facilities that could be there. I really, really believe that we have the world is our oyster, and I think we should be looking at all things on the table. You know, I know that there's been talk about possibly whether it be like a private or voucher type of thing. So, you know, maybe what if the new nursing home can accommodate 100, right? And then we have, you know, 25, 30, 50 that are in a skilled facility. And then we have maybe a carve out for 50 that we could actually give a voucher to and have, you know, a public-private partnership. I think we should be looking at all options on the table here, and I know we can get it done. And we're in a bad time. I mean, fiscally, and people are struggling to put food on their table, and especially in Rochester. I mean, we have the haves and the have-nots in Rochester. The low income are destroyed right now with increased property taxes as well as the middle income. And unfortunately, it's a combination of Republicans and Democrats that have got us into this mess. But the people, we've created an unbelievable two-class system. And in Strafford County alone, I think we're one of the worst affected out of the entire state. And I know that we can't fight. There can't be any more fighting. We just have to have real solutions and get all the experts in and say, okay, here's our options. And then we deliver that, and I believe we can get it done.
Well, I think that's the right answer, is you guys look at everything. That's what you're saying. Look at everything, analyze everything, come up with the best plan. I think Mark, you're on that.
So I would like to think that we meet, once a month, but we thought maybe over the summer, it's realistic to only have one meeting in between July and August. Is there any idea about that? And do people have a preference? Another thought was to have it, that summer meeting the same day as the executive committee meeting, as we have a lot of the same people. Maybe we could do both those meetings with lunch in between. Any thoughts?
Yeah, but I think that is a really good idea speaking, because we've talked about being fiscally responsible. It's a really good idea. First of all, time wise, for you guys, if we can double up, that we do the second, what is it, the second quarter?
The second.
The second quarter,
That won't happen until like August,
Mid-August,
mid-August.
like the second week of August.
Yeah,
So it would be basically 2 months from now.
August, isn't
Yeah, I think I disagree. I think we should have, I think that the summer is the time. I think we
Okay.
should have another meeting. I'm fine with that.
That one
Um,
between now
I
and.
want a list of our to-dos, so then we can come together, and have like, where we've gone out and said, okay, like you're going out to bid, right? Let's go out and get all the research together and then let's come to meet about it. So
Sure.
let's have a nice little clear thing about goals. We can look at private options. We can look at all of these different things. We can look at the current nursing home structure and all of that, and then numbers, and let's see if we can come together. And when we do come together, if there's some gaps, then we can fill it in. But I think 2 months is too long.
Okay.
Okay,
I think it is too, I think it should be at
Great.
least once a month.
all right.
I'd like to go to Marinette.
Okay.
Up there.
Yeah, can I, yeah, that, I was gonna say, if we can, I don't know, maybe do a tour of some other, I know we did one in Carroll County that was very helpful, it kind of gives you some ideas. But, maybe see other counties together, who can go, somebody could set that up and.
I can set any of that up.
Maybe
Yeah.
not just other.
Anywhere you wanna
counties, but
go.
Other states,
Yeah, it
if
would be
somebody's better at it.
Yeah.
Hawaii?
Yeah, Hawaii, yeah.
Yes, let's.
There's not, nobody goes.
On your
to
own,
nursing
Dad.
homes, come on. But I think that that would be helpful.
Summer
See other locations.
vacation, but not on the taxpayer side.
Yeah.
We'll have Chicken Man pay for our vacation, right, Tom? Tom,
One
you
night.
throw us on a
I guess I
go
could do the
vacation.
11th.
Chicken Man.
All right. We throw some dates out there.
Ground.
Yeah, I'd like to see us have some place where we can get some of the background information, so between meetings that we can download some of these documents and read, and maybe perhaps.
Like
You know,
a 15-year one. I'd like to
If,
see
well,
that.
I went online and saw some of the work that was done, in 23. And I suppose I could review that, but, there's all stuff out there we need to learn.
Okay.
And we can do that on our own. Meetings should be about exchanging ideas, not about, well, I guess it's like teaching, but we can do a lot of learning or preparing on our own if we have access to good documents. And there are people here who know what would be good documents for us to review.
We can do that before the next meeting. We'll put together a baseline information of reports. I think we can talk with the commissioners and the administrator of what we think is the basic information, so that, I agree, I generally like people to have read and walk into a meeting, be ready to roll, so that we do efficiently. So we will have that before the next meeting.
Thank you.
How about like the second or the third week in July? So of course, we've got July 4th in the beginning, so how about that? So it's like a month from now.
I like
I
Fridays.
could do the 11th, yeah, I would.
I love Fridays, if we can
Well,
keep it to
stick
Fridays.
Friday, but, I could only do the 11th for the 25th. And can we have a show of hands for?
On the 11th.
11th is fine with me.
Good.
Morning,
For morning meetings,
Yeah.
preferred?
Can everyone do the
morning
11th?
on the 11th.
Yep.
That's
Okay,
pretty good.
okay.
9, do you wanna do 9
Yeah,
again?
that's perfect.
You're talking.
And we won't let the Glare speak at that meeting.
Although I do recommend that you start writing a book.
Yeah, actually,
Yeah.
Yeah, wealth of information, and it would be good for.
Yeah, we should.
Representatives to get that.
If we take the recording of this, that can be like dictated, and then we'll give it to you and you can put it in order, because I think that that is really wonderful. People.
You know something, Janet, there's an app out there, rather than you doing what you're doing.
Yes.
You can turn that app on and it describes everything for you.
It does, however, when more than one person talks at a time, it's
Oh,
all jumbled. I've tried it.
You have tried it.
I have.
Yeah, we've tried.
Yeah, we tried.
Well, we could shut up and then.
we need a corner. What did you say? What did you say? That's not like.
Just have a different public on each table.
One person.
But we
Like we should
do
do.
where money is with it.
So can I do one advertisement before you leave?
Yes, is this
Cause
field
this
day?
is this field
Okay.
day, if you were thinking of becoming a farmer or you're complaining about the costly food, please come to this. This actually came up if you're on the government committee, I believe it is. This, they wanted to highlight what their equipment is and why they ask us for money, and it's kind of cool, so.
So I'm on the environment and agriculture, and we have an unbelievable list, and I'll send this out specifically from me to the entire house, because I think it's really important, but through E&A, we have a huge connection here, and this would be wonderful for especially our folks that are on the committee up north and stuff.
Thank you.
Send it out to each town.
All right,
Have you given this to UNH as well in
I
regard to?
can do that. I can
Yeah,
pass it
can you give that to UNH?
on.
All right,
It's
so-
cooperatively with UNH, so that-
Yeah.
I'm sure UNH probably already has it. but
Okay,
hopefully-
good. Yeah, but they should push it out to their community.
Yeah, I'll make a motion to adjourn.
So,
Okay.
second.
the meeting's
Oh,
adjourned.
are we gonna talk about what it is you want for the next meeting? Are you gonna figure that out?
We can talk.
You let us know,
Let us
and
know what
we'll provide you whatever you want.
Yep.
Put together